good afternoon. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Thank you for joining us today for our live chat, online chat, Saving Your Behind, Strategies to Prevent Colorectal Cancer in collaboration with Friends Health Connection. Colorectal cancer is the second most common cause of cancer-related death in men and women. During today's discussion, we will learn more about risk factors for colorectal cancer and what you can do to prevent the disease. We are joined by Dr. Kristen Lee, a gastroenterologist at Robert Wood Johnson University Hospital, Somerset, and Digestive Health Center, and Karen Connolly, registered dietitian at Robert Wood Johnson University Hospital, Somerset's Steeplechase Cancer Center. Thank you both for joining us today.
Thank you.
Thank you again. We will start with a 20-minute moderated discussion with Dr. Lee and Karen, and then we will take questions from the audience. So Dr. Lee, let's begin by giving our viewers an overview of the colon and the rectum and their roles in the body's digestive process.
Sure. The colon is the last part of our digestive tract. It is the large intestine. The primary role of the colon is to act as a storage facility for our waste. So food gets mostly digested and absorbed in the small intestine, and whatever is left over goes into the colon, where it is stored and further processed. For example, most of the water absorption occurs in the colon, and absorption of other minerals and vitamins. And eventually, the waste goes into the rectum, where it's eliminated from our body as stool.
Okay. Thank you so much. So I know, especially in March, when it's Colorectal Cancer Awareness Month, people are very concerned that they, may get colorectal cancer. Can you explain what that is?
Colon cancer is usually an adenocarcinoma, which means that it's a malignant growth from the lining of the colon and rectum. It usually begins from a small polyp called an adenoma that is precancerous. And over time, this adenoma obtains more mutations and can transform into a malignant growth and grow into a cancer. That process takes a long time, approximately 8 to 10 years.
Oh, wow. Okay, thank you. So can you explain to our audience, what are the risk factors for colorectal cancer? Like, which risk factors are modifiable and which ones aren't?
Yes, there are a lot of identified risk factors for colon cancer. The non-modifiable risk factors are those that you are born with. For example, gender. Men are more likely to get colon cancer than women. Family history is a risk factor. So if a first-degree relative, meaning your parents, siblings, or child, develops colon cancer, your risk goes up twofold. That being said, most colon cancer occurs sporadically. More than 80% of patients who develop colon cancer do not have a family history. Other non-modifiable risk factors include ethnicity. For example, African Americans are at higher risk of developing colon cancer than other ethnicities. And a family history of any hereditary conditions, such as Lynch syndrome or these genetic syndromes, which are rare. The modifiable risk factors are some things that you can control that you develop later in life. For example, obesity. Obesity is a risk factor for colon cancer, and so is lack of physical activity. So the more you exercise, the better chance for you in terms of colon cancer risk. Other modifiable risk factors include your other medical conditions, such as diabetes, can increase your risk of colon cancer. So controlling that also helps. Cigarette smoking as well as alcohol consumption are risk factors for colon cancer, as well as diet, which we'll get into shortly. But diet high in fats as well as red meat or processed meats are a risk factor for colon cancer, and diets that are low in fiber are also risk factors for colon cancer.
Wow. Well, thank you so much. That was a great explanation. So, Karen, what kind of dietary changes can we make to prevent colorectal cancer, since Dr. Lee brought up diet, if you wouldn't mind explaining that to our audience?
Sure. There's several different dietary changes that you can make that will help lower your risk of colorectal cancer. One of them, like Dr. Lee said, is decreasing your intake of red meat, avoiding processed meats. Then there's increasing fruits and vegetables, as well as increasing foods that are high in fiber, incorporating calcium and vitamin D rich foods, and limiting alcohol.
Oh, wonderful. Well, I'm sad on the alcohol part, but yeah. So I know when we talk about, diet, fiber always comes up. So what role does fiber play in colorectal cancer prevention?
Well, like Dr. Lee mentioned, fiber can act on a lot of different ways. It can help slow absorption of carbohydrates, so that as a result can help manage blood sugar levels a little bit better. It dilutes harmful substances in the colon and it helps prevent constipation, so nothing's really staying too long in your system that shouldn't be there. And it also contains phytonutrients and phytochemicals that are found only in plant-based foods, and those have been found to help prevent against cancer as well. So it's a multifactorial way that it can help prevent colorectal cancer.
So what is fiber and how much should we consume every day?
Fiber is an essential nutrient. It's only found in plant foods. And our intake of them should be around 25 to 30 grams per day. 25 grams for women and around 38 grams per day for men.
Okay, great. So can you explain, what are the best sources of fiber? And then how do we add more fiber to our diet? I think you covered a little bit of that, but if you could elaborate.
Sure. I think it's important to get a variety of fiber from a variety of different foods. So fruits and vegetables, whole grains like barley, farro, quinoa, nuts and seeds also have both insoluble and soluble fiber. So getting a variety of different plant foods in every day will guarantee that you get a good amount of insoluble and soluble fiber.
Oh, great. Thank you so much. So early detection is key to identifying colorectal cancer at its earliest, most treatable stages. Dr. Lee, what are the screening guidelines for colorectal cancer?
Currently, the screening guidelines, and these are for average risk individuals who have no symptoms of colon cancer or colon polyps, include stool-based testing, imaging, as well as something called a colonoscopy. So stool-based testing looks for occult blood in your stool that can be shed by large colon polyps as well as early colon cancer. It should be done annually, and if it is positive, it needs to be followed up with the colonoscopy. There is a newer stool-based study called Cologuard that looks for blood as well as abnormal DNA that gets shed by large polyps as well as colon cancer. Again, if this test is positive, you need a follow-up colonoscopy, and the Cologuard should be tested every 3 years. Imaging-based study is called a virtual colonoscopy. It uses a CT scanner to look for polyps within the colon. You do require a bowel prep, so you still need to clean out your colon for the exam. And again, if it's positive, you have to follow up with the colonoscopy, and the virtual colonoscopy should be repeated every 5 years. Now, a colonoscopy is sort of the gold standard because you're able to detect the smallest polyps and at the same time prevent colon cancer by removing polyps at the same time. It does require a bowel prep and sedation. After the colonoscopy, if you have no precancerous polyps, you should repeat it in 10 years.
Okay, great. So you touched a little bit upon it, but what can somebody expect when they get a colonoscopy?
Sure. So the thing I tell my patients is that the worst part of the whole process of a colonoscopy is actually the bowel prep. Everyone hears about it from their friends and family members. You do have to drink a lot of liquid that contains a gentle laxative. So drinking that amount of liquid may be difficult for some people, and you are expected to have diarrhea. But it's the most important part of the colonoscopy because clearing the colon, the better chance we have of finding colon polyps. On the day of the procedure, you'll meet our anesthesiologist who's going to give you sedation through the IV. So the procedure itself is very comfortable because you're sleeping through the procedure. On average, it takes about 20 minutes. And during that time, we could remove polyps that we see. And afterwards, in the recovery room, we'll discuss any findings that was found during the procedure.
Wonderful. So what do you tell people who might be afraid to get a colonoscopy, whether it's prep or just in general?
I've heard a lot of different excuses or reasons not to have a colonoscopy. It includes, like you say, a little embarrassment, modesty, or just the idea of going under sedation. But what I tell my patients is that the process, if you go through it, is very simple and easy because the sedation works very quickly and it wears off very quickly. And colon cancer is the most preventable cancer there is because colonoscopy overall has decreased the incidence of colon cancer in our country. That's why it's so important to get it done so that we could prevent colon cancer by removing these polyps at an early stage.
Okay, well, thank you. What other options are available for diagnosing colorectal cancer? So I think you mentioned a few, but if you can maybe reiterate and then share if there were maybe some other options available to people.
Sure, the screening tests do help towards the diagnosis of colon cancer. Like I mentioned, the stool-based testing, the virtual colonoscopy that uses a CAT scan machine, and the colonoscopy. But the way to really diagnose colon cancer is by direct visualization and biopsy. So tissue samples are important. So the colonoscopy would be the best way.
Okay, great. Now, we hear sometimes about sigmoidoscopy. Is that beneficial at all to diagnosing colorectal cancer?
Yeah, so a sigmoidoscopy is a partial colonoscopy. Some people may prefer that because sometimes you don't need the whole bowel prep or the procedure. And at times you can get this done without sedation because it's not a whole colonoscopy. However, it is looking at only about a third or less of the colon. So it doesn't guarantee not removing polyps that are more proximal in the colon. But it is a procedure that is recommended, and you could repeat that about every 5 years.
Okay, great, wonderful. Thank you so much. So I think at this time, we can go right to questions from our audience. So I think if you all could maybe explain, I know there sometimes, maybe Dr. Lee, you can go into for us, you know, there's the fecal occult blood test, as you mentioned, FIT test, and the Cologuard, I think that you mentioned. Can you maybe explain to our audience, those typically are tools for, diagnosis that are at take home. Can you explain to our audience what each is and how effective they all are? That might be beneficial for our audience to know as well.
Sure. So the fecal occult blood test, as well as the FIT test, are different ways to look for microscopic blood in the stool. From colon cancer and colon polyps, you can sometimes shed blood very slowly and in small quantities. So you don't see that through the naked eye. So it applies a special chemical and staining looking for heme particle, which is part of blood, in the stool. So it's looking for that. However, there are high false negative rates. So because of the sensitivity is not great, you need to repeat it every year.
Okay, wonderful, thank you. Now, Karen, from your perspective with diet, you talked a lot about different foods where you can get fiber. Is there a specific meal, like when you're making, when you have fruits, vegetables, things like that? I know here at the hospital, sometimes we offer something called the freekeh salad. And, it's a different recipe that our audience, may not be aware of. So can you offer some suggestions like freekeh, and you might want to even explain what freekeh is, that, is a really good source of fiber as well.
Right. Freekeh is a young wheat, so it's harvested when it's young, so there's a little bit more protein and fiber and vitamins and minerals in it. It's similar to wheat berries. It's a little bit chewy. It has a nutty flavor, but it's good. You could, we always like to combine things. You could make a salad with that. You could add, red pepper, you could add chickpeas, you could add spinach to it, and then you could make it, if you were to do that at home, you could do it for dinner, and then you could take leftovers and add it to a salad. A lot of it is combining and trying to add more fiber into each meal so that you reach that fiber goal.
Okay, Awesome. So we have a question that from our audience member that they've heard that certain diet cleanses can actually damage your colon. Dr. Lee, is this true?
So there's a lot of commercialized sort of cleanses out there that people sell by companies that are not FDA regulated, as well as some home remedy cleanses. People think that these are good for them because it's sort of cleaning your colon and removing all toxins from your system. But sometimes it could be more harmful in a sense that it could dehydrate you. Not everybody needs to go through a cleanse. It's not something that we recommend for our patients for a quote unquote healthy gut.
Okay. So, having said all this, if somebody is eating healthy, exercising, I mean, what are their chances of getting colorectal cancer, and when should they explore, actually, seeking diagnostic treatment if, they're under the age of 50?
So for most patients under the age of 50, the things we look for are family history, like I mentioned. So if a first-degree family member have a precancerous colon polyp on their colonoscopy or colon cancer, then you should receive a screening colonoscopy before the age of 50. We usually say by 40 or 45, or at least 10 years before the initial diagnosis of your family member. Other things that we look for are, colon cancer, actually, signs and symptoms are very non-specific, but when there's any sort of rectal bleeding, to be safe, we do recommend a colonoscopy to make sure there's nothing worrisome like a large polyp or a cancer that is bleeding.
Okay. So I know folks sometimes from our community have said, well, they have hemorrhoids, and sometimes the hemorrhoids may cause some spot bleeding. At what advice can you give those individuals who do suffer from hemorrhoids and do occasionally get that spot bleeding? What recommendation would you make?
Sure. So hemorrhoidal bleeding tends to be more bright red because it's distal. However, when patients come to see us for first-time bleeding, we do recommend an endoscopic workup just because we cannot rule out a more proximal source. And then when you determine that the only source of bleeding is in fact the hemorrhoids, which are totally benign and very common, we work with the patient to find something to help prevent hemorrhoidal complications. It includes actually fiber. I do recommend fiber a lot to my patients, even if they feel regular. It could only help them. It helps them with all their other health and prevent colon cancer, but it also helps the stools to be very soft, bulky, and regular, and prevents any sort of straining that could aggravate the hemorrhoids. Also, from severe hemorrhoids and complications, we do provide banding in the office to help shrink the hemorrhoids off.
Oh, wonderful. Good to know. So the other question on the flip side, you have some folks who suffer from constipation, and sometimes they worry, is constipation, is that dietary related? Is that, something going on with my system? So for those who suffer from that, is there a higher risk of them getting, colorectal cancer? And then again, and I think this is maybe a joint answer, but what would you do to alleviate that constipation?
So there are many types of constipation. To get to the root of the question, chronic constipation does not increase your risk of colon cancer. We sometimes say that a acute, more subacute, or acute change in the way you go to the bathroom may be a symptom or sign of colon cancer, but it's not always the case. There are different types of constipation, such as idiopathic. Some patients have constipation without any other reason. Sometimes there's something called slow transit constipation, where your gut is a little slower than usual. There is also irritable bowel syndrome with constipation, and something called pelvic floor dysfunction. And your gastroenterologist can work with you to determine the type of constipation and come with a good bowel regimen to help you go to the bathroom. But sometimes increasing fiber and water in your diet itself can help with your constipation.
Right. I think, depending on what's causing the constipation is how you can best manage it. but certainly, you know, increasing the fiber and then doing that slowly, because you want to, you know, fiber it can make you feel bloated, and so you want to try to, if you're not already on a high fiber diet, you want to try to increase that more slowly so you tolerate it the best. But incorporating more plant-based foods and trying to get, you know, again, by doing that and having that variety, you're more guaranteed to get in enough fiber, but also the fluid, because if you don't have the fluid intake and you increase the fiber, it'll have the opposite effect. So you want to make sure you have the, you know, good hydration and a variety of foods.
Okay, so Karen, here's a question for you. Is it possible to have too much fiber in your diet?
Sure. I mean, I think, you know, again, it's how you respond to it. You know, if you're bloated and you're uncomfortable, you might be increasing it too fast. You know, I don't know. Do you feel like there's such a thing as too much fiber?
There's no toxicity from fiber, but like Karen mentioned, there are intolerances.
Oh, all right. That's comforting to know. So, Dr. Lee, you had mentioned earlier, you had talked about some gastrointestinal disorders like IBS, diverticulitis, things like that. Maybe if you could share with our audience, does any of those gastro issues impact colorectal health?
So in terms of colon cancer risk, irritable bowel syndrome, diverticulosis, which is very common, do not affect colon cancer risk.
Okay.
Colon cancer health, it's difficult to define what colon cancer health is, but we do want to achieve a good bowel sort of schedule for the individual so that they don't feel discomfort like cramps and bloating and pain.
Okay, very good. And I'm just checking. So that's all the questions that we have from our audience. Would either of you, do you have anything else you would like to add on the importance of colorectal cancer prevention?
I just want to emphasize that colon cancer, again, is the most preventable cancer. It's a great, the screening methods are easily tolerated, and a great way to detect early cancer that's the most treatable. And even without a family history, the other day I had a patient who said, I feel fine, no one in my family has colon cancer, but even without a family history, you do have a risk for colon cancer. Most of the colon cancer that is diagnosed, like I said, 80% do not have a family history. So please see your doctor, see your gastroenterologist, and pick a screening modality that is comfortable for you and screen to help prevent colon cancer.
Wonderful. Karen, any last words from you?
And I would just like to say, you know, looking at the modifiable risk factors, if there's things in there that you notice that you can change, you know, those are, you know, by changing that, you can greatly reduce your risk of colorectal cancer, amongst other types of cancers and preventable diseases. But with diet, fiber is one part of it, but it's also, you know, that focusing on plant-based foods, getting in a variety of different foods, lean protein, and it's the synergy of all those foods together that probably gives you the most benefit and the most cancer prevention ability. So I would just try to do as many different foods as possible, and physical activity.
All right, wonderful. Well, thank you everyone for joining us today for our online chat with Dr. Kristen Lee and Karen Connolly from Robert Wood Johnson University Hospital, Somerset. And a special thanks to our partners at Friends Health Connection for making this presentation possible. Please remember, these opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call 1-888-MD-RWJ-UH. For more information about cancer services at Robert Wood Johnson University Hospital, Somerset, please visit our website at www.rwjbh.org/Somerset. Thank you all very much, and we hope to see you on our next webinar.